Oh, but it's a fun topic. We're going to talk about skin stuff. And I don't even know if it's recording, but we're going to talk about skin stuff. Okay, we have 5 categories. Antibacterials. I can't even say that. Anti-acne. Should know how to say that. Antifungal, antiviral, and then miscellaneous. So let's talk about antibacterials. We have 4 different drugs. Bactracin. This prevents local infection. Adverse effects can include itching, burning, and inflammation. Pretty easy. Neomycin, minor skin wounds. This is the drug that's in Neosporin. We all know what Neosporin is. Muprocin, this is for staph, strep, and MRSA. Adverse effects, itching, burning, and minor pain. Kind of makes sense. It's going to be on the skin. And silver sulfadiazine, I hope I said that right. This is for burns. So if your patient has a really bad burn, you do need to make sure that you clean the site as best you can before you apply this. You typically apply this with a sterile Q-tip or a sterile dressing. It can come in big tubs, especially like in burn departments, but you do need to make sure that your patient's wound is cleaned first. Adverse effects include itching, burning, and pain. And this drug, since it's a sulfadazine, I can't say that right, it is contraindicated in patients who have a sulfa allergy. So nursing implication right there. Next category, anti-acne. Benzoyl peroxide. This resurfaces skin. Like every acne medicine or acne face wash out on the market at drugstores has benzoyl peroxide in it. Everybody loves it. This resurfaces the skin. So their adverse effects are going to be peeling, redness, warmth, blistering, and swelling. Sounds pretty bad, but this is all typically called keratolytic. That's just what keratolytic means. It causes peeling, redness, warmth, blistering, and swelling. Tretinoin, I hope I said that right. This is Retin-A. Adverse effects include skin peeling, red blisters, crusted skin, and changes in color. And then isotretinoin. This is old Accutane. This is typically used for severe cystic acne, and it is super, totally, 100% without a doubt contraindicated in pregnancy. This is the drug that they make you take a pregnancy test every month to prove, oh, you're not pregnant, you can continue being on Accutane. This causes severe birth defects to the fetus. Remember, I think it was like the 50s, doctors would prescribe thalidomide to moms for morning sickness. Then they started having babies born without limbs or other horrible birth defects. That was because of thalidomide. This drug is known to cause those birth defects. It's pregnancy category X. Women cannot take this drug while pregnant. It's not good. So contraindicated in pregnancy. I'm pretty sure there's a black box warning with this too because it's so severe. But I mean, it's not listed here if it is a black box warning. I'm assuming that. I don't know. There's like a website that you have to like pledge, like, I will not be pregnant. I will use 2 forms of birth control while on this drug to prevent pregnancy. Nursing implication, it can cause liver damage. So just a little side note down there. Antifungal, we have talked about some of these drugs before. Clotrimazole, probably said that wrong. 2 forms, lozenge and lotion. If it's a lozenge, it's for oral candidiasis. That's the drug, that's the formula that they cannot chew or swallow the lozenge. They have to suck on it and let it dissolve slowly. The lotion is used for athlete's foot. Miconazole, hope I said that right. It's an antifungal that's used for yeast and gram-positive infections. And adverse effects include local irritation, itching, burning, and scaling. The antiviral we have talked about again. This is Aclovir. This is the non-HIV drug that there's no cure for HIV there's no cure for this virus, but it helps decrease healing time. And then the miscellaneous drugs are permethrin, which can be used for lice. This is normally found in a shampoo rinse for the hair. It's available over the counter, and it's a very safe drug and can be used for children. So it's the drug of choice for children. Ectoparasites, which is just little insects on the surface of the skin. So this drug helps stop that. And pediculosis, I hope I said that right. It's also for lice. And for a patient who has lice for a long period of time and is using this drug can discolor the skin. So I'm going to let you see how to spell these words. Remember, these are the antibacterials, anti-acnes, the antifungals, the antivirals, and the miscellaneous drugs. We have talked about antifungals before, antivirals, and some antibiotics, but we haven't talked about these antibiotics. But we have talked about these before. So if you want to see these, just search like antivirals or antifungals within the channel and you'll see more information about that. So there you go.